Hello guys, welcome to online MBBS lectures. Today we are gonna learn about normal labor. So what is labor? Series of events that takes place inside the genital organs in an effort to expel the viable products of conception out of the womb through the vagina into the outer world is called labor. What is labor? Labor is a series of events that helps the viable products inside the womb to get out to the outer world. Okay, it should start more than 37 weeks but less than 42 weeks. So when does normal labor usually takes place is it takes between 37 to 42 weeks. Okay, what is Braxton Hicks contraction? It is very important term. Okay, so Braxton Hicks contraction, it is also known as prodromal labor or practice labor or false labor. And during this contraction what happens is practice contraction are irregular uterine contractions usually felt during second trimester or third trimester of pregnancy, and it may start during 6 weeks also, but it's usually not felt until the second or third trimester. Labor pain. Braxton Hicks contractions change their character, become more powerful, intermittent, and are associated with pain during labor pain. Okay, the pains are more often felt in front of the abdomen or radiating towards the thighs. In labor pain what happens? In true labor pain, the pain is felt in front of the abdomen and it radiates towards the thighs. Okay, radiating towards the thigh is very important character. Okay, you will not see this radiating towards the thighs in false labor. Normal labor. Labor is called normal if it fulfills the following criteria. So what are the criteria? Let's see. Spontaneous in onset and term. The contraction should be spontaneous and at term. At term means after 37 weeks. So usually it's after 13 weeks. After 13 weeks to 42 weeks is usually known as term. Okay, term period. So with vertex presentation, and the presenting part should be vertex. Vertex is the the parietal region of the head, that is the vertex region. Okay, without undue prolongation, and the time duration should not prolong. Natural termination with minimal aids, and by the use of minimal aids like use of a second person help or like simple vacuum is also considered as a minimal aids we can do without having any complications affecting the health of the mother or the baby. Okay, and during normal labor the health of the mother and the baby should be fine. It's not disturb the health of the baby or the mother. And you can see here in the picture which is the vertex. Okay, you can see the sagittal you can see this part. Usually this part is known as the vertex region. Okay, and this is the presenting part during normal labor. So true labor pain. True labor pains are characterized by uterine contractions at regular intervals. So what is true labor pain? These are the criteria that happen during true labor pain. So uterine contraction at regular intervals, at regular intervals. This is the very important point during true labor pain. Frequency of contractions increases gradually, and there is gradually increase in the frequency of contractions. Intensity and duration of contractions increase progressively, and the intensity and duration also increase. Associated with so what is so? What is so? Okay, so is so can be defined as the expulsion of the there is cervical mucus plug, and the cervical mucus plug is expelled out, including some blood. That is known as so. Okay, we will later learn about it. And then progressive effacement and dilation of the cervix. There is progressive effacement. What is effacement? Effacement, we can say that the thinning of the cervix can be said as effacement. Okay, there is gradually thinning of the effacement. Okay, and dilation of the cervix, and the cervix is dilated. Descent of the progressing part. and there is descent of the progressing part, like the head, or the head and the vertex, usually the vertex. Formation of the bag of four waters. What is bag of four waters? We will learn in the next slide. What is bag of four waters? Okay, these okay, we will learn in next slide. Not relieved by enema or sedatives, and true labor pain is not relieved by enema or sedatives. Okay, so here you can see this is the placental region, and then cervical mucus plug. Here is the cervical mucus plug. Usually, during pregnancy time, the cervical this path, this is blocked, okay, by cervical mucus plug, and we learned so this is so, like when the cervical mucus plug is expelled out, including some amount of blood, and that is called as so. Okay, and this is the vagina, cervix, amniotic sac, and this is the umbilical cord. Some important phenomenon. So okay, so we will learn here about so in detail. Okay, you can see here in this picture, this mucus plug is expelled out. Okay, in so what is so? Expulsion of cervical mucus plug mixed with blood is called so. It can occur just before labor or in early labor. So what is so? Expulsion of cervical mucus plug mixed with some blood is called so. Okay, it is a very important phenomenon during normal labor, due to a stretching of the lower uterine segment. And why it is expelled out? Due to a stretching of the lower uterine segment, the cervical mucus plug is expelled out. Okay, and then comes formation of bag of waters. So due to a stretching of the lower uterine segment, the membranes are detached easily. During normal labor, what happens? There is a stretching of the uterine segment, lower uterine segment, and with the dilation of the cervical canal, the lower pole of the fetal membranes become unsupported and tends to bulge into the cervical canal. As it contains liquor which has passed below the presenting part, it is called bag of waters. Okay, and you can see here in this picture, this is called bag of waters. In this bag, what there is presence of liquor, and it is stretched down, like it bulges. What happens? It bulges into the cervical canal, and this is called bag of waters. It is also very important phenomenon during labor. Now we learn about false labor. Okay, we learned about the normal physiology. Now what is false labor? Okay, false labor is found more in primigravida than in multiparous women. What is primigravida and what is multiparous? Primigravida are women who has become pregnant for the first time, is called primigravida, and multiparous are women who have already given birth more than once. And if she had given birth to a baby just once, then that would be called as primipara. So it usually appears prior to the onset of true labor pain, by 1 or 2 weeks in primigravida and by a few days in multipara. Such pains are probably due to stretching of the cervix and lower uterine segment with consequent irritation of the neighboring ganglia. False labor pains are dull in nature, confined to lower abdomen and groin. You can see here in this picture, false labor pain are mainly in this groin area. And what we learned about true labor pain. In true labor pain, what we saw, there was pain in the abdomen area, lower abdomen area, as well as it was radiating towards the thigh. I had noted it this point. But in false labor, what happens? There is no radiating towards the thighs. Okay, towards the inner thighs in false labor pain. Just it is limited towards the lower abdomen. And what happened? Not associated with hardening of the uterus. And in false labor pain, there is no hardening of the in normal. What happens during labor pain? The uterus becomes very hard because it need to contract and it becomes very hard. But in false labor pain, the uterus is soft. It's not very hard. Okay. They have no other features of true labor pains, and what we learned in the true labor pain, they don't have such features in the false labor pain. and it usually relieved by enema or sedatives, and false labor pain is usually gone by if enema or if you take some sedatives and it is relieved. Okay guys, thank you. In next lecture we will learn about stages of labor. So see you